I want to talk to you today about isolation and quarantine. Both are public health practices to prevent the transmission of contagious diseases such as COVID-19. Isolation is for those who have been infected and generally lasts 10 days. Quarantine is for those who have been exposed to someone with COVID-19 and lasts 14 days. So one way to think of this is that infection and isolation both start with an I. Quarantine is for those who are questioning whether they will develop COVID, both start with a Q. In both isolation and quarantine, you should stay at home except to get medical care, and you should separate yourself from others who are not infected. Isolation, again, it's for those who are infected with the virus that causes COVID-19. They will have had a positive test, but they may or may not have symptoms. Isolation can end when the following conditions are met. It has been 10 days since the onset of your symptoms, and you've had at least 24 hours without a fever, without using medications such as Tylenol, and your symptoms are improving. If the onset of your symptoms are not clear, or you had no symptoms, then you should isolate for 10 days from the date of the positive test. In most cases, you do not need to test again. Quarantine is for those who have had a close contact with someone who has COVID-19. Close contact is defined as being within 6 feet of someone for more than 15 minutes, providing care for someone at home, direct contact such as hugging or kissing, sharing eating or drinking utensils, having someone sneeze or cough on you. Public health might also define close contact as spending an extended amount of time in an enclosed space with someone who has COVID, even if you did not come within 6 feet. After exposure to someone with COVID, not everyone will become infected. Infections can develop as early as a few days, but some can take up to 14 days. Because of this, you should remain in quarantine for the full 14 days. While in quarantine, you should monitor for symptoms such as fever, cough, or shortness of breath. If you develop symptoms, you should arrange to get testing. If you do not develop symptoms, you should consult with your healthcare provider or public health about recommendations for testing. Even if you have a negative test while in quarantine, you should continue to isolate for the full 14 days. If, though, you have a positive test while in quarantine, you would now be considered infected, and you will need to isolate for another 10 days. Note, if you have tested positive for COVID-19, you do not need to quarantine for 90 days after the positive test if you have a new exposure.